Masala Radio.
I want to talk to Dr. Jayesh Sheth, who's on line 1. He's calling in from Atlanta. Dr. Jayesh Sheth. Good afternoon, Dr. Sheth.
Good afternoon.
How are you, sir?
Hey, doing very well.
Jayesh Sheth, who is the medical director, CEO of Houston's #1 med spa, Ameriju Med Spa. Several locations here in Houston, several locations in Atlanta. He's a medical director. He's a CEO. He's an entrepreneur, and also the CEO of MCFI that gets you EB-5 visas, construction projects. He does so many things, but he also is a doctor. He practices medicine, and he's in the front lines fighting COVID. He's treating patients who are suffering from COVID-19 coronavirus. I'd like to find out, Dr. Sheth, Dr. Jayesh Sheth, welcome to the show. Thank you for taking time out and in all the good things that you're doing and wonderful things. And I want to just congratulate you for being there at the hospital and treating patients, you and your staff, Dr. Sheth.
Thank you.
How is it treating? I don't know anybody in my circle of reference, people that I know, who is suffering from COVID-19, from corona. But you are treating people. How is the situation?
Well, different stages in different cities. And as you know, I have a practice in Louisville, Kentucky, Atlanta, Georgia, and also in Houston. So, but it is getting worse. More and more people we are finding everywhere who has been diagnosed with COVID-19. I know of a friend in Houston whose both the parents are tested positive. They are doing well, treated, and so that's the fact of life. It has come suddenly. It is growing rapidly, but it is there. In all 3 markets, I have seen people that is positive. We are treating them and hoping that the spread slows down with all the measures that we are currently taking.
I hear about medical supplies, not enough medical supplies, not enough ventilators and masks and all of that. Is that true with you in your hospital?
Would you repeat the question?
I've heard about not having enough, the medical staff, the people in the front lines, doctors, nurses, not having enough equipment, ventilators, masks, just not having enough medical supplies to treat patients.
That is true. That is a fact for our practice and 15 physicians that currently work for our practices. We do have enough of PPEs, even in outpatient clinic. Most of we have changed to telemedicine, but it is correct that many of our healthcare professionals, physicians, nurses, and all other support staff, they are put in a position where they are not being provided. To describe that situation, I would compare if we were to send our soldiers to war without any armors. That is the situation. I know several friends who are in New York. They are buying PPEs themselves, paying for it. There is a kind of a underground. We send those to them when they go to work. We have had several instances also in Atlanta where these hospitalist physicians, we are sending them 4 or 5 masks at a time. We are using the shower caps, disposable shower caps as a head cap for like a surgical head cover. So yeah, lot of things are there. There is shortage of it, but that is the reality of it, that we were not ready for it. Most of the places now have. We have found out ways to reuse some of the supplies. Coming from India, having been trained in India in old days, many of us remember that we were always using cloth-based masks and gowns, PPEs. Those were autoclave sterilized and reused. So same techniques have been put in place to reuse. So we are able to use a mask about a week, reutilizing, re-sterilizing those with different ways in autoclaving and all of those. So those are the solutions we have found. But in many of the places, currently there are no PPEs available, and it has overwhelmed the system. For those healthcare providers, the listeners, they should really find a way to get the PPEs from the administration. Lots of decision making that the current health systems are doing by not providing to them or prioritizing the healthcare service providers, it is nothing but criminal. I'm very verbal about it. I ask all the healthcare providers, healthcare professionals, to insist on getting those, protect themselves.
Okay. Now, if I've heard of a test. A lot of people are like, "Hey, am I asymptomatic? Do I have it? I wonder." And I've heard of a test that if you take a deep breath in and if you can hold it for 15 seconds, and if you hold it and you don't cough, then that means you're fine. You don't have this. Is there anything that I can do without having to go to the hospital and without having to go through a test to make sure that I don't have this?
So let me make a statement which is going to kind of come as a shock to you and many of the listeners. We are all going to get exposed to, and most of us will get coronavirus infection.
What? Are you serious?
Yes. Yes. That is, we are not trying to...
Is it because in the USA we're not social distancing like people are doing it in India, where just everything is shut down and people are just staying at homes and really nobody is leaving? Here we are still getting out, we're still doing our things, we're still going out there, and even though we meet, we have social distance, but is it because of that?
So earlier or later, we are going to get it. All of these actions of social distancing, lockdown, curfews, all of that is being put in place is to delay from most of the people from getting coronavirus infection. It is to not have all of the people get coronavirus infection at the same time in the same 4 to 6, 8 weeks.
Because the hospitals are not geared to treat everyone. If you have people, multiple and hundreds and thousands of people rushing to the hospitals just don't have enough equipment, doctors, nurses, beds to treat everyone, and therefore a lot of people will die. The whole flattening of the curve. So what you are saying is, if we flatten the curve, it's good for us, but eventually most people are gonna get this. And does that mean the number that Trump was talking about, 100 to 240,000 people dying of this? How much do you subscribe to this theory?
So, America's demographics, we have more older people than younger people. So it depends on so 87% of the people are going to get mild disease or no symptoms, right? So all of us are going to get exposure. All of us are going to get viral infection from COVID, but not all of us are going to be symptomatic. Not all of us are going to have severe disease.
And not all of us are gonna, and not everybody is gonna die from this.
Correct. So there are some people who are high risk. Okay, and as we go to answer your question, how do I know if I have coronavirus infection or not?
Right now, yes.
Right now, unfortunately, we don't have enough testing. There are some of the things that say that you have coronavirus infection. If you are able to do your tidal volume, your capacity, inspiration capacity, or what is called a vital capacity is higher, then you do not have coronavirus infection. This is not a proper interpretation. What I call is that is a Baba Ramdev interpretation. That you do not have the disease in your lungs that is negatively impacting your lung function. So even if you have coronavirus infection,
it doesn't affect my body or my ability to function, but I still might have it.
You could have it.
So I don't. So the whole theory about holding your breath 15 seconds and you, if you don't cough, would you just say that's just a hoax?
It is not hoax, but it is a way to put it that you do not have the negative impact from coronavirus infection if you have it. You cannot scientifically say that you can do so, that means you do not have it, because remember, 87% of the people are still continuing to be able to do so. Because they would have infection in their throat. Also, there are some positive signs or research that is coming out. Most of the people who are Indian born, they would have received BCG, which is a TB vaccination.
Yes, we do. Yeah, I've had it.
TB vaccination is an immunomodulator. What we are doing is we are giving a TB virus, so it creates an immunologic reaction in your body, and that immunomodulation that those people who have BCG vaccination are not getting coronavirus infection, or actually they are getting milder disease.
I've heard of India. They were saying, Hindustan Times reporting that the TB drug is working on corona.
It is more of a TB vaccine that is working on your immunological system, so it prevents you from getting as bad of a disease. Okay? So what are the risk factors for people? Who are the people who should be worried? Okay? Number one, older individuals. People older than 65. And you remember my background. I'm a geriatrician, fellowship-trained geriatrician, and practiced geriatrics for many years. That is taking care of older people.
Yeah, exactly. You are taking care of older people. Yes, and I'm talking to Dr. Sheth, who is a medical doctor practicing, and he's out there in the front lines treating patients, treating COVID-19 patients. He's also the CEO, the medical director of Houston's largest med spa, Ameriju Med Spa, and MCFI. And he's on the phone with me, and I'm asking these questions that I have, that people have. So everything you tell me, so you're telling me about the high risks. The older people, I've heard older people are high risk, but more and more I'm seeing on social media, and I've got a friend, well, not somebody directly related to me, but a friend's friend, 40 years old, and had coronavirus, shortness of breath, went to the ER, came back, said, we got to do a test, came back, 3 days later, admitted to the hospital. 2 weeks now, he's on life support. Everybody in Houston has heard about this, Rohan Bavadekar, and they're looking for plasma from blood group A, AB, because his lungs have failed, his kidneys have failed. And it's so scary to hear this.
Indeed. So, there are many of the things we don't know, but there are general information about it that we know for sure that these are the group of people who are getting severe disease. Okay? And number one of that is, on the same token, the friend I'm talking about, her parents both have the disease, both were positive, in their 70s, both of them, had a fever for 2-3 days, really took care of them at home, given some medications. They had fever for 3 days, got better. Yesterday I got a call. When I talked to them, they're doing better. No fever for 24 hours, no shortness of breath. We took care of them at home.
Because that's good to hear. That's good to hear.
They both has had lung disease. One of the ones.
Oh my God.
Her father has a COPD, has a lung disease, but he's also doing fine. I'm hoping he will be okay. So it is not a guaranteed thing that you are older than 65, you have diabetes, you have other immunologic disorders, you are taking immunosuppressive medications. Your overall immunity is low. That is when all the viruses, including COVID-19, attacks you more.
Is there anything I can do? I've got a 90-year-old mother. Me, there are a lot of people out there, people listening to the show. Anything that I can do to prevent me from getting this virus or prevent me from spreading, if I have it and I don't know I have it, prevent me from spreading this?
Absolutely. So there are a few things everybody can do, okay? And these are general things. Again, this is not
I understand.
medical advice.
Of course not. We're on the air. We're not, we're not writing any prescriptions on the air. But you are a medical doctor. You are practicing this. You are treating patients with COVID. And so I want to know, what can I do so that I don't get this and I don't spread this? And I've got, for me especially, having a 90-year-old mother at home, every day I check her temperature. Every day I make sure that she's okay. If she coughs, it scares me.
Absolutely. Absolutely. So here are the things that one can do. Okay? There are, and this is like what President Trump said. You do things that you know is not going to hurt. You may or may not know if it is going to help. But there are many of these things that is going to help. These are general, common things. There are several of these things that Ayurveda, Ayush medicine, those are recommendations made. So here you go. Number one, you can start taking vitamin C. If it is not contraindicated, vitamin C is thought to be general immunity booster. Okay. So antioxidant. So vitamin C, generally people say you take a gram of vitamin C a day.
1 gram.
Number two, 1 gram. Number two, zinc. There is 50 milligrams of zinc available in market. We use zinc at 220 milligram dose to treat people who have COVID positive tests. It is anecdotal, but there is a good research paper that has come out of China. I was in a webinar a couple days back from Shanghai Medical Association, their Infectious Disease Society. They have shared those things, that 220 milligrams of zinc was effective in treating for 10 days. I recommend you take some zinc, maybe 50 milligrams a day, as a prophylactic preventive measure to help boost your immunity. Third thing, steam inhalation. These are the things that...
What's the third thing?
Steam inhalation.
Oh, steam. I see. Steam inhalation. Okay.
Inhalation. Correct. So, when you are taking a shower, take hot shower, have steam inhalation. You could do steam inhalation. There are Japanese recommendations. They recommend really to be in a steamy place. One of the docs, a good friend of mine in Dallas, I was with him 3 weeks back in a hot yoga, which
hot yoga, yes,
have stopped now. But that heat is really helpful in preventive growth or coronavirus, COVID-19, sticking to your throat, to your nasal cavity and sinuses, which is where it infects you first. So that is thought to be helpful. It is anecdotal. There is no study that is done, but it does not hurt. So steam inhalation, they recommend a couple times a day, along with hot shower separately, or whatever ways you can. Fourth thing is, of course, a prevention is you prevent exposure. America recommended not to use masks to people. I think that was the most flawed information that ever came out from CDC, NIH, or Dr. Fauci, or anyone else.
Yeah, I used to hear that. If you're not infected, you don't need to wear masks. Don't wear masks. It's okay. Only the people that are infected should wear masks. And
that is the worst. That is the worst recommendation that came out, because there were two pieces of information they were using. Number one, they were saying this is not an airborne disease. Hoax. Wrong statement. It is airborne disease, but it usually spreads through respiratory droplets, which last for quite a long period of time or a long distance, depending on the temperature, the humidity, and circulation of air, right? Where air is recirculated, like cruise ships.
Yes, in cruise ships. That's why cruise ships are disaster areas.
So it is airborne. Number two, asymptomatic individuals are the worst offenders, unknowingly, but they are the worst offenders to pass this thing through. And that is why, even today, I recommend what, as a matter of fact, yesterday, President Trump, very common street smartness, he said, put a scarf on. Everybody should use face mask. You going in your studio should use face mask. And I'm talking about not a N95 mask, right?
Just any common face.
Exactly. There is a way for us to use handkerchief. In US, we don't use handkerchief.
Yeah, in India, people go out there. I've seen people on the bikes and they're all using a handkerchief.
Exactly. There is a very common way using two rubber bands. You could make handkerchief into a face mask, and you could use that, right? Two rubber bands, and you could make that into a face mask and use it. Any face mask is better than no face mask. That is the one thing that, as a matter of fact, America did wrong by recommending not to use face masks. They did so because they did not have as many face masks.
Or maybe they didn't have the right information, because a few weeks ago, what did you think when you were watching TV and Donald Trump was saying it's just a flu? This is just like any other flu.
I don't think he ever meant. I think it was to calm people. And I would give you that as a professional, I did not take that in terms of I took that statement with a grain of salt.
I see.
But I would say that the effect that it had on, remember, despite that statement, and as you know, President Trump's followers have a pretty significant impact of the statement that he made. And he did help in calming people down. Otherwise, not only the toilet tissue, we would have run out of every little thing from the department store. People would have freaked out because people still remember the war days.
Yeah.
And, so I think that it was more of a meant in a non-medical way about calming people that we will be okay. I do believe that it may have done not a justice to many of the people where, they took the message as that it is not serious and mainly did not prepare us for it.
Now, when do you see the apex hitting the top and then the numbers slowing down? Because they are not slowing down every single day. We see more deaths than the day before. In your medical, from your medical professional experience, when do you forecast seeing the peak?
I think the peak would be different for different markets. America is like all different states or different countries. And so, different states are in different stage of the disease. So average, it will be next 4 to 8 weeks. Everybody will be coming up and getting to a plateau level. We also do not have many of the people who have coronavirus disease, but we have not diagnosed them, who are asymptomatic.
Yeah.
Tests are coming out. Today I was given the news that we had 500 spot tests, which would give you results in 15 minutes, shipped. So we are going to receive that on Tuesday or before in our offices, and we would be able to test them. Because of that limitation, right? Roche Diagnostics put those out. They are able to do 40,000 tests in a day. Okay, so if there is a limitation of how many tests we are able to perform. We are running about a week behind for getting the results. But in next week to 2 weeks, we are going to have the spot test, IgG, IgM test. We are going to be flooded with those in the market. We are going to start doing those currently, we are not even able to do the test in every symptomatic patient, remember. Even if you have respiratory symptoms, you have history of exposure, if you have mild disease, we are not able to do that test.
I see.
And so right now, if we have a healthcare professional, if we have somebody who has the risk factors, we would do the test on them, but we would get the results after a week. Okay? So that is going to change in next week to 2 weeks, which is a very good news. If a community practice like ours, we start receiving this test, that means everybody...
Yeah, everybody's getting them. Everybody's getting them, which is great news. It is great news. What is your thought on India? 1.3 billion people crashing into each other, touching each other, shoulder, hands, arms, everywhere. Why only 1,000 cases in India where we have 200,000 cases here in the US?
Well, I think one of the reasons is under testing. We have not tested so many people, okay? And that is why you do not have that many diagnoses. Now, as you know, India also has indigenous tests that was approved out of Pune. Dr. Bhargav, his patent, one of the local physicians and biochemists work there. So the tests are more available now in India. As we do more of the testing, we will have more of the findings, positive cases. But there is also thought to be few other factors, and rather than factors, that's a hope or a prayer. Number one is the BCG vaccination. We have a pretty good BCG vaccination rate in Indians. Number two is the hot weather. There is actually a...
So if I've got a BCG vaccination when I was young, most of the Indians have got this BCG vaccination. If we have it, is that the little dot on your left arm?
It is. Yeah, it is. It, depending on who is looking at it, would tell you little or lot. You should ask ladies. And say, how is your deltoid? You look at your shoulder, and if you have this little a dime to a quarter size skin mark, that is BCG vaccination. Okay, it is like branding, right? It is branded.
I've got one. It's not a dime. It's actually smaller than a dime, but I've got it on my left hand, and it's always been there. I remember getting one. Just one I have, but it's smaller than a dime.
Yeah, that's it depends on how old you are. Older you get. No, I'm just kidding. Older you get, smaller you get. No, but yeah, that is it. That is it. It depends on how much reaction your skin gave to BCG vaccination at the time. But most of the people have it. That is, hopefully, I pray that there is a benefit.
Good. Good.
Number
That's
two
good to hear.
is the hot weather, temperature.
The hot weather. So I'm hoping, we all say that, and I'm all hoping that in the summer, that as summer comes around, as May comes around, it will treat, the weather will treat this.
Yes, hopefully.
Yeah.
Now that is what happens with SARS. That is what happened with MERS. That it kind of died down with hot weather. Viral activity generally goes down. Right, flu season is almost over. In April, you do get up to 15th of April. So that is there for sure.
Now, you are in the front lines, Dr. Jayesh said. I'm talking to him. He's in the front lines treating COVID-19 patients in Atlanta. He's the CEO, the medical director of AmeriJuve, largest med spa in Houston. He also has med spas in Atlanta, AmeriJuve in Atlanta. Have you gotten tested yourself? Are all your staff members working out there, are they also getting tested? Because you're out there working with patients.
We are testing. We are using PPEs from head to toe. All our staff members, not only the doctors, they are covered with a hair cover, face shield, eye shield, or the eyeglasses that covers them tightly, because it is thought to be transmitted also through your eyes. A face mask, complete gown, and shoe cover. So,
wow,
they are in a full hazmat dress up. And we have tested 3 of our staff members All three have come negative, sorry.
Yeah.
All three have come negative. None of them has been positive so
Have you
far.
gotten tested yourself?
No. We test only
Why not?
if we have symptoms. Because we are doing a good job on PPE.
I see.
If you have all the protection, and no healthcare worker should knowingly go unprotected and expose themselves.
Right.
Right? They are
Right.
doing a disservice to themselves.
And the families and the communities and everybody, yes.
Everybody, absolutely.
I agree.
So we have done a great job on that part from day one. Fortunately, we had that. Every one of our providers have had that cover, and we update them on regular basis. So that is why we test only if that is positive. We are comforted that those people who had symptoms, we done the test, and those have come back negative. It can be prevented. That was also finding from Shanghai Infectious Disease Society that the healthcare professionals, if they use a proper PPE, they did not get coronavirus disease.
This is some great information that we are getting from Dr. Jayesh Sheth, who's fighting this disease as a medical doctor in the front lines, in the hospitals, treating patients with coronavirus. I'm going to repeat a few things he said that we could all do. Vitamin C, 1 gram, zinc, 50 grams. Of course, this is not a prescription that he's guaranteeing or in any way.
It's a 50 milligrams.
50 milligrams. 50 milligrams. Vitamin C, 1 gram. Steam inhalation twice a day, hot shower, hot bath, and the prevention, a mask. Everybody should be wearing a mask. If you can't find a mask, a handkerchief around your nose, your mouth, cover your nose, cover your mouth, get up. I used to laugh at people and I would say, what are you doing? The government says you wear a mask only if you have it. Do you have it? So don't have that stigma that, I'm wearing a mask, people think I have it. Everybody should be wearing a mask. That is a prevention that you must follow. These 4 things are important. Dr. Jayesh sat with us. I actually had some more questions for you, but I'm wondering if we can do this on a regular basis. Can we get you on the air tomorrow around the same time? Because I've got some other questions. I also have questions about Amerijuve. And Amerijuve is you had to close your locations nationwide. I want to talk to you about that too tomorrow. And also I want to ask you about, as a business owner, as an entrepreneur, a business owner, there is this SBA loan and PPP that's available, and you might have some information that you want to share, and I will promote this, and I will let people know that we're going to have Dr. Jayesh Sheth on the air, and we're going to be talking about this tomorrow. If you can give us some time tomorrow about the same time.
Sounds like a plan.
Okay.
I would be glad to.
This is wonderful. I'm getting a lot of response. I'm getting some messages, a lot of questions that I will formulate, and I will ask these questions to you tomorrow. It's wonderful that you call in, and I want to commend you for the job that you're doing, you and your staff, and I want to congratulate you for working in the front lines and helping America.
Thank you, and you are also a part of it. So spreading the right information and not spreading the fear or preventing it from spreading is the right thing to do. This is a difficult time. I'm hoping this is the only time in all our lifetime that we have this situation. It is a 1 in a 100-year time thing.
We will talk again with Dr. Jayesh Sheth, and I will get him on the air because I see that a lot of people have questions and it's helping a lot of people. People are asking me, at least 11 messages I'm seeing on my board on our WhatsApp. Can you repeat? And I will post this tomorrow. I will post what he said. It's just, what would you call this? Not a prescription, but what would you call these 4 things that you said? If I had to post it, what headline should I say?
You could say that general guidance for preventing coronavirus disease.
Okay, all right, which is good. General guidance for preventing coronavirus disease. I'll post this tomorrow. We'll talk to you tomorrow about the state at Amerijuve, the status of Amerijuve. We'll talk about the SBA, the government loans, PPP. You've got some information about that, and I'm sure many business owners, small business owners, would love to hear your experience and how to go about doing this. We appreciate your time. and good luck with treating all the patients that you are, doctor. It is truly heartwarming, the work that you're doing.
Thank you very much. You all have a good one. Bye-bye.
All right, sir. Take care.
Thank you.
Dr. Jayesh Sheth.
Masala.